Good morning friends, welcome to my YouTube channel, and today I am going to describe the mandible in detail. First of all, the mandible, it is the lower jaw and it is the strongest bone of the face. Now the mandible has a body which is horseshoe shape and it has a pair of rami. This portion is called as the ramus of mandible and this portion is called as the body of mandible. So it has two ramus and a body. Ramus provides attachment to the muscles of mastication. Now talking about the body, body has two borders and two surfaces. This one is the outer surface, okay, and this one is the inner surface. Is it clear? Outer surface and inner surface, and it has two borders. This is the upper border which gives attachment to the teeth, and this is the lower border. This is called as the base of mandible. So it has two borders, upper border, lower border. This one is the outer surface, and behind here we have the inner surface of the mandible. Now talking about the outer surface of the body of mandible. See, when the mandible develops, it develops from the right half as well as from the left half. Both they fuse in the center. Now this is called as the symphysis menti. The fusion of the right and left half of mandible, this line is called as the symphysis menti. This portion is called as the mental protuberance. It is triangular projection in the lower part of the midline. The inferolateral angles are called as the mental tubercles. And we can see there is a foramen located here. This foramen is called as the mental foramen. This mental foramen gives passage to the mental nerves and vessels. Now we can see this is the oblique line. What is this oblique line? This is actually the continuation of the anterior border of the ramus of the mandible to the body. This is called as the oblique line. And just below these incisor teeth we have these two depressions. One depression here and one here. This is called as the incisive fossa. So these were features which were present on the outer surface of the body of mandible. Now talking about the inner surface of the body of mandible. Inner surface of the body of mandible shows a elevation. This elevation, this prominent ridge which runs downwards and obliquely, this is called as the mylohyoid line. Now just below the mylohyoid line, this depressed portion, this hollowed out portion is called as the submandibular fossa, which lodges the submandibular gland. Now just above the mylohyoid line, this portion, this is called as the sublingual fossa, where the sublingual gland lies. Now see, this was the symphysis menti. Posterior surface of the symphysis menti shows these elevations. These elevations are called as the genial tubercles. These are called as genial tubercles. Actually they are 4 in number, 2 upper and 2 lower, which give origin to genioglossus and geniohyoid muscle. So this was all about the inner surface of the body of mandible. Now talking about the borders of the mandible. See, this one is called as the upper border, and you can see that there are sockets. These sockets are for the roots of the lower teeth. So upper border bears the sockets for the roots of the lower teeth, whereas this lower border, it is also called as the base of mandible. We can see this is the lower border called as the base of mandible. Now near its midline, these two depressions, these are called as the digastric fossa, which gives attachment to the anterior belly of digastric. So these were the features on the body of the mandible. Now we will discuss the features on the ramus of mandible. Now we can see that the ramus is quadrilateral in shape. It has two surfaces, 4 borders and 2 processes. Two surfaces are, this one is called as the lateral surface and this surface is called as the medial surface. It has 4 borders. The upper border, this one is the lower border. Here we have the anterior border and here we have the posterior border. It has 2 processes. This is the coronoid process, and this is called as the condyloid process. This is the lateral surface of the ramus of the mandible. It is flat and it provides attachment to masseter muscle. Now the inner surface. Inner surface bears a foramen. This foramen. This is called as the mandibular foramen, which transmits inferior alveolar nerves and vessels. Actually, mandibular foramen, when we move inside the mandibular foramen, we can see that it goes into a canal and exits out of the mental foramen. So inferior alveolar nerves and vessels, they pass through this mandibular foramen, they enters the mandibular canal, and finally they exits out of the mental foramen as mental nerves and vessels. Just below this mandibular foramen, there is a groove. This groove is called as mylohyoid groove. It lies below the mandibular foramen, and mylohyoid nerves and vessels are present here. Just anterior to this mandibular foramen, we can see this tongue-like elevation. This is called as the lingula. It provides attachment to the sphenomandibular ligament, which attaches to the spine of sphenoid and to the lingula of the mandible. Now about the borders. This is the upper border. This is called as the mandibular notch. And this is the lower border which continues with the base of the mandible. This is the anterior border which is very thin and it continues with the body as the oblique line. This is the posterior border which is comparatively thicker than all the borders. Now this process is called as the coronoid process. Coronoid, why? Because in Greek it is called as crow's beak. It is like a crow's beak. It is called as coronoid process. It is a triangular projection. What is the location? It is located antero-superior. आगे की तरफ और ऊपर की तरफ. This is the antero-superior projection called as the coronoid process. It gives attachment to a muscle. It gives insertion to a muscle which is named as temporalis muscle. Posteriorly, this portion is called as the condyloid process. It has a head. Then it has a neck. The head is flattened antero-posteriorly and forms a joint with the temporal bone. The joint is called as the temporomandibular joint. Now just below the head, this portion is bit depressed. This is called as pterygoid fovea. This is called as pterygoid fovea, which gives insertion to the lateral pterygoid muscle. The coronoid process is situated antero-superiorly. It is also called as antero-superior angle. Whereas the condyloid process is located posterior-superiorly, पीछे की तरफ और ऊपर की तरफ. It is also called as the posterior-superior angle. This was all about the mandible. Thank you.